Otitis Media by Taylor Galloway, Jennifer Goldsmith, Danielle Klein, and Alyssa Rosenberg. Otitis media is a common middle ear infection. It's marked by the middle ear becoming inflamed and is a prevailing disorder during adolescence. As you see in the picture, the difference between otitis media and a normal middle ear is the infected fluid around the ossicles. 3/4 of children will experience at least one episode of otitis media by the age of 3, which leads to a temporary hearing loss for the affected child. By age 6, children with chronic otitis media will have recurring episodes, since symptoms of otitis media vary day by day. Parents will need to visit an ENT once they notice their child having specific symptoms, such as fever, crying, or drainage from the ear. Parents need to seek out assistance from the doctor immediately, because if they do not, the child can develop hearing loss or damage. Since otitis media is characterized by a decrease in loudness of sounds, it is important to have the doctor check your child out, considering children develop an abundance of language and auditory skills in the first 3 years of life. The two most common types of otitis media are acute otitis media and otitis media with effusion. Acute otitis media is defined as inflammation of the middle ear and fluid filling it. A child with acute otitis media will usually have pain when the eardrum is bulging or perforated. The physical difference between the two can be seen in the picture. Therapy for acute otitis media will often start with the use of analgesia. Analgesia is a frequently used painkiller when treating acute cases. Children as young as 2 years old are eligible to receive this type of treatment. In cases where the patient is allergic to penicillin, they will often be given Zithromax, Ceftin, or other antibiotics when prescribed. In cases where the patient is not responding after 72 hours of treatment, it is recommended that they be re-examined. Otitis media with effusion consists of serous or mucoid fluid in the middle ear cavity. Since this fluid is non-infected, the child usually does not have any of the acute symptoms. When treating a patient with otitis media with effusion, it is recommended to clear the excess fluid without the use of antibiotics, decongestants, or nasal steroids. The most commonly accepted method of treatment for this type of otitis media is surgery, including myrigotomy, with or without tube insertion, adenoidectomy, or both. These pressure equalizer tubes are in charge of getting rid of the fluid in the middle ear and bringing them to the throat. This will be beneficial because the less fluid that there is in the ear, the more air there will be. These tubes are extremely helpful considering they lower the chances of obtaining another ear infection without causing any long-term damage to the ears. Differential diagnosis distinguishes a disease from others with similar symptoms. For example, differential diagnosis with otitis media include mucotyphanic effusion, laryngitis, purulent, mastoiditis, cholesteatoma. Because of these diagnosed symptoms involve the middle ear typhanic membrane or mastoid process similar to otitis media. Mastoiditis is caused when a bone behind the middle ear becomes infected. Cholesteatoma occurs due to a tumor growing inside of the middle ear. When examining a patient for otitis media, doctors will use a pneumatic otoscopy as seen in the picture. Pneumatic otoscopy involves inserting an otoscope into a patient's ear to form a seal. The purpose of creating a seal is to stop air leaking between the speculum and ear canal wall. While performing this procedure, doctors are trained to search for a bulging typhanic membrane. A typical tympanic membrane is intact, convex, and translucent. Therefore, a bulge in the typhanic membrane is the most prevalent sign of otitis media and an indication of a middle ear disorder. Doctors may use a tymphanometry to assess the middle ear function. Tymphanometry is an examination to test the mobility of the eardrum and the conduction bones by creating variations of air pressure in the ear canal. To complete this procedure, doctors will first do a visual assessment with an otoscope of the ear canal and eardrum. Then a probe with a flexible rubber tip is put into the ear. This probe causes the air pressure in the ear canal to change as low-pitched tones are played. Lastly, while the procedure is occurring, measurements of the eardrum movement are recorded. Otitis media is a conductive hearing loss impacting one or both of the middle ears. A conductive hearing loss is identified by a decrease in loudness of sound. However, the clarity of the speech will remain unharmed. A conductive hearing loss can range from mild to severe in all ages, although young children have a prevalence of conductive hearing loss. The sample audiogram that we provided shows someone with a conductive hearing loss as a result of otitis media. Since a conductive hearing loss can range from mild to severe, the audiogram can vary as well. In this audiogram, the patient has a mild conductive hearing loss with a normal bone conduction threshold and an abnormal air conduction threshold. With this in mind, we are able to find the air-bone gap at 0.25, 0.5, 1, 2, and 4 kilohertz. And finally, here are our references. Thank you so much for watching.